Hi, my name is Dr. Caroline Novak, and I'm a vein specialist at the VIP Medical Group's Vein Treatment Clinic. Today I'm going to talk about vein repair, all the treatment methods available for varicose veins and spider veins, and how to choose the best option for you. Varicose veins and spider veins are unhealthy blood vessels that develop as a result of a disease called chronic venous insufficiency. The saphenous veins, a set of veins that run below the surface of the skin in the legs, are particularly prone to vein disease. Instead of sending blood up towards the heart, valves within the saphenous veins become ineffective and the blood falls back downwards. Over a long period of time, this leads to increased pressure in the veins and new spider and varicose veins develop. In the past, surgeons would perform a procedure called vein stripping to repair unhealthy veins. They would make small cuts along the leg and actually pull out the saphenous veins. These procedures were associated with relatively high rates of infection and recurrent venous disease, as well as clots within deep veins, and patients would have to stay in bed for weeks afterwards. Now, modern technology actually enables doctors with advanced ultrasound training to perform minimally invasive vein procedures that are both more effective and less painful for the patient to cure vein disease. Options including endovenous ablation, sclerotherapy, and Venocil, or vein glue, all result in high rates of vein repair when performed by a vein specialist such as myself. Veins, just like the people who have them, are unique. A comprehensive vein evaluation usually involves an ultrasound where the veins within your legs are carefully mapped, identifying areas that are unhealthy. Your vein doctor can then use this imaging to develop a comprehensive treatment plan to take care of your vein disease with as little difficulty as possible. Again, I'm Dr. Caroline Novak. To learn more about your options for vein repair, visit us online at www.veintreatmentclinic.com or schedule an appointment to see a vein doctor in person. I hope we're able to help.